want to say this, good work, team. You guys did an outstanding job. Thank you, Mr. Chairman, and I thank the ranking member as well, and the ranking member on the subcommittee, and of course, the chairman of the full committee. So I want to express my strong support for the aims to H.R. 3281, the Transparent Price Act. This legislation pulls together the culmination of over a dozen bipartisan bills that begin to tackle true price transparency and address skyrocketing costs in our healthcare system. I want to thank again Chair Rogers and Ranking Member Pallone for negotiating this deal, and of course, the chairman and the ranking member on the subcommittee. It includes fully offset federal healthcare workforce program extenders at increased funding levels, such as community health centers. I've been proud to lead the bipartisan legislation, the appropriation letters each year. And earlier, the last few years with others, but initially with Ranking Member Pallone, to ensure discretionary funding is provided to our community health centers, and I'm glad to support Dr. Joyce's efforts to reauthorize the Community Health Center Fund for the next 2 years. Community health centers, as everyone knows, plays an essential role across the U.S., including in my home state of Florida, where they are integrated into rural, suburban, and urban communities to provide vital primary care and referral resources. This package also includes legislation I've co-authored, H.R. 2550, with Representative DeGette, that will extend the special diabetes program for the next 2 years, as well as a bill from Representative Cole to extend the special diabetes for Indians program, both an increased funding rate of $170 million per year. These new investments in research will help maintain and spur on additional innovation in the search for new treatments and cures for type 1 diabetes. We are making great progress in this space with new FDA therapeutics coming to market that delay the onset of type 1 diabetes. Great progress. We can only imagine the future strides that will be made as a result of greater investments and sustained research funding at NIDDK. Additionally, this comprehensive package builds off the policies we examined in our legislative hearing 3 weeks ago to provide much-needed transparency and accountability in healthcare. This includes additional updates to better operationalize and simplify the price transparency rules at CMS so that it actually works for patients at the hospital and insurer level. It also requires off-campus hospital outpatient centers to attest to unique identification codes to ensure compliance with existing site-neutral laws and statute for Medicare. And it provides overdue accountability for PBMs to annually provide employers with transparent data on cost sharing and drug spending via rebates. Lastly, it includes legislation I lead with Representative Schakowsky, H.R. 3262, the Reporting on Ownership Information of Health Specified Entities Act. This will require hospitals, emergency centers, ambulatory surgical centers, insurance companies, provide equity firms, and others to report and disclose data, HHS, on ownership-related information, including on any changes in ownership and data on mergers and acquisitions. Our proposal will then require the agency to publicly report this ownership information and publish an analysis of trends in horizontal and vertical consolidation in the marketplace. Additional clarity into these trends will allow us to better understand anti-competitive practices in healthcare that may be driving up costs and find ways to combat these practices. I know I don't have much more time. All of these transparency initiatives are aimed at ensuring that employers and consumers are armed with the information they need to shop and understand where their dollars are going in the healthcare system. Ultimately, we must put patients at the front and center of this process rather than charged with bills and medical that they cannot afford. All right, I'll stop right there, Mr. Chairman, but it's a great amendment, and I appreciate the chairperson offering the amendment. Terrific bill. Let's get it done. Thank you, and I yield back.
Okay, the